Leadership in Healthcare Management by Quantes L. Spears. Leadership models. What are leaders? W.C.H. Prentice, 1961 article said leadership as the accomplishment of a goal through the direction of human assistance, and a successful leader as one who can understand people's motivations and enlist employee participation in a way that marries individual needs and interests to the group's purpose. What are leadership models? Leadership models help health leaders and health executives and managers navigate and make decisions. Issue in healthcare management. An issue in healthcare management is inadequate staffing. Inadequate staffing is a problem that has affected many organizations, especially since the rise of COVID-19 and the different laws and policies in effect and beliefs of COVID-19. There's a shortage of workers and healthcare personnel, which is leading to a reduced employee morale because of the increased workload, because of the loss of workers, nurses, respiratory therapists, phlebotomists, healthcare executives, staff such as cleaning services have to work extra because of the shortage of workers, which adds on more stress to their lives, which burns them out. Because of the increased workload, the stress, and the burnout, employees will have a low job satisfaction, which will contribute to the high turnover rate. And the high turnover rate with the reduced employee morale and stressed out employees leads to poor quality care for patients. If there is a shortage of workers, patients aren't getting the adequate care they need, the adequate amount of time and quality attention they need towards their care because there's a shortage of workers and all patients need to be seen. So time isn't split fairly for all patients. Time is based on priority. With the correct staffing in order and the right amount of training, patients can be seen and provided with quality care. And with quality care of patients will lead to quality outcomes, meaning improvement in outcomes, which will reflect on the organization positively. My healthcare model. My healthcare model is based on the dynamic culture leadership model, which is based on transformational leadership and situational leadership. My leadership model will also encompass the servant leadership and ethical leadership. With the combination of all of these leadership models and styles, I believe it would help me be a more fair, a more just leader who can lead with integrity, someone who's able to motivate and understand their coworkers, subordinates, and stakeholders. One who can influence and guide others. One who's able to be welcoming so everyone can be open and honest, and to help create a culture of honesty and integrity. My healthcare model will be based on communication and leadership. With communication and leadership, leaders are able to come up with different plans and strategies to help guide the organization, to help build an understanding on the organization's mission and vision and values. Improving in communication with leadership, determining how training is going to go, rewards for employees, incentives to help build an effective culture for the organization, to create a supportive environment for new employees, to attract new employees. Strategic planning, including processes that are interdependent with the mission and vision, strategy, and objectives that align with the organizational goals, which will help plan responsibilities. Decision making. Creating a decision making process for common situations and for guiding leaders and managers in a decision making process that aligns with the goals of the organization. Decision making such as planning and having a hiring process for attracting and recruiting new employees, training for groups of employees, ways to retain employees, employee enhancement is assessing the knowledge and skills and abilities and experience of trustworthiness, the practice of increasing and reducing responsibilities. appropriate to the unit, group, individual, in line with the organizational culture as a part of development and strategic and operational plans, according to Letlow. Assessing employee skills will help benefit the organization because leaders can see the strengths and weaknesses of the ones who work for the organization, the ones who run the organization, the ones who help build the organizations and its reputation and its culture. Knowledge management and organizational learning. Knowledge management and organizational learning captures what the organization knows and what it has learned that improvements to effectiveness, efficiency, and efficacy can be achieved. Leadership planning and decision making are facilitators of the organizational learning. Evaluate, reflect, and retool. Evaluate leadership and management and employees' performance. Reflect on data from evaluations and assessments. From the data and assessments, come back and make adjustments. Strategy to apply the model. Creating policies that will help and enact organizational goals. Policies to help retain and attract employees, such as flexible scheduling and requirements of flexible scheduling. Incentives. Having regular meetings with leadership and with staff. Having decision making open to staff. Creating a culture where everyone feels comfortable to share decisions, where innovation is supported and embraced and rewarded. Having regular trainings on the culture of the organization, trainings on emotional intelligence to increase emotional intelligence, trainings on cultural competence to increase cultural competency within the organization, trainings on ethics and processes so everyone is in accordance with the organizational goals and vision. Evaluating the effectiveness of the model. The way to evaluate the effectiveness of the model is to measure objectives such as having a certain amount of applicants apply for the job at a recruitment fair, having a number of recruitment fairs, having hiring events, online or in person, establishing a time period. How many hiring events do you want to have do we want to have within a certain amount of time period? What is our goal within a few months or within a few years? How many people do we hope to attain and attract for how many positions? And does our goals and objectives are consistent and aligned with the organizational mission and strategy and goals of the organization? Evaluating efficiency through surveys to assess leaders, management, and employees. Impacts of the model include increased teamwork from communication, team building, meetings, and working together. Efficient work processes from increased teamwork and understanding of processes and practice. Strong organizational culture through trainings, meetings, and reinforcing goals of the organization. A strong organizational culture will be built. And with a strong organizational culture, an organization can run efficiently. All or most employees will have a sense of integrity, honesty, and will want to work towards the purpose of the organization, to want to help others, to want to deliver quality, to want to help measure quality, to make sure their performance is up to par. The end. Thank you.